Good morning, students. How are you? Hope you all are fine. Dear students, first of all, give me your attendance. I'm just waiting for your attendance. Yes, beta, give me your attendance. Many of the students, they have just sent me attendance. Yes, many of the students, let me check your attendance first. Amrit Pal, yes, Astha, Riva, Ajay Karanveer, okay, Varun. Many of the students, they're just sending me attendance. Let me check your attendance. Then I just start the class. Okay. Jatin. Okay. Bache, one question from Astha. Astha, I just give you answer. Wait. Let me take attendance first. Rudra present. Nirveer, Harmanpreet Singh, Abhijot, Varun. Okay, many of the students are present. Digvijay also present. Gurpreet Kaur present. Manjot Singh Sani present. Okay, students. Okay. Thank. Okay, students. Gautam Rajput present. Yes, brother of Jaskaran also present. Hanukor. Okay, beta. Thanks for your sending me attendance. It is very difficult for me to take just announce the every name because yes, board is visible. Thanks for giving me answer. Gupartik Kaur. Thank you. Okay, bache. Now let's start a lesson. Thanks for your sending me attendance daily. Thank you very much. Okay, bache. Now I have to start the which Jasprit also present, Nupur also present. Now, beta, let's start a lesson. Okay. Hanji, beta, last time what we have covered. So, beta, first of all, it is a request to all of you, please come on time. You have to just be present before time. Right now, only 41 students are present. They missed some topics, then they will not be able to understand next thing. So please present on time. Okay, beta? Last time, first of all, I want to repeat what we have covered. We have covered, first of all, that is mode of transmission of diseases, like means of spread. First 5 minutes, I want to recap that topic which I have covered. I have covered means of spread, like how disease spread from infectious person to healthy person. There are two methods. One is direct transmission. Second is indirect. Directly, if the disease will be spread from infectious to healthy person. Indirect means they need some intermediate to transfer of disease from infectious to healthy person. Indirect transmission of diseases, we have discussed different points like contact with infected person, like there will be a contact with infected person. Example is chickenpox, measles. Second, droplet infection through coughing, sneezing, spitting. Example is tuberculosis, pneumonia, common cold. Then we have discussed about contact with soil, that is transmit tetanus, that bacteria present in the soil, it will be just passed to the injury, it causes tetanus. Then we discussed about animal bite, that is a rabies disease cause rabies virus. Then we discussed through placenta, like disease is AIDS. Placenta is connection between mother and fetus. If mother is suffering from any disease, it will be passed to a fetus through placenta. Placenta pass out everything. It is a tube that connect, like respiration, excretion, everything occur through this tube. It will be just everything, whatever the mother is eating, it will be passed to a baby through this tube. So if mother is suffering from any disease, it will be just passed to a baby. So it is a direct transmission of disease cause, example AIDS. Now we discussed about indirect mode of transmission. Examples contaminated water and food. Example is typhoid, cholera, diarrhea. Through air, airborne diseases. Even in exam they can ask question, Ishmi, you are very late beta, late for class. Okay beta. Then bache, contaminated air, even they can ask name to waterborne disease, name to airborne disease. कंटामिनेटेड एयर से कौन सी डिजीजेस होती है बेटा, लाइक कफिंग स्नीजिंग से सम ड्रॉपलेट्स इमिटेड डिजीज कॉज निमोनिया ट्यूबरक्लोसिस. ओके, देन vector is that carry disease, example is malaria. Mosquito carry disease from infectious to healthy person. Then we discussed about contaminated blood, needle, example is AIDS. Like if doctor used a needle infected like to person, that person is suffering from AIDS, same needle doctor will use for another person, then there will be 100% chances spread of this disease from infectious to healthy person. Then after this, fomites-borne diseases I discussed. Hope you all read the notes which I have given to you. I just click the photo and send to you WhatsApp. Hope you all read that notes. Okay beta, fomites-borne disease, when any article come in contact with infectious person made the source of that infection, like coronavirus. Like if you can just example like disease spread patient clothes, utensils, crockery, door handles of cupboards, windows. Beer can pathogen and it will be transferred to healthy person. Okay, so this was about means of spread. Then I discussed about organ tissue specific manifestation with you. Hanji, like see beta pathogen. This is beta only revision which we have covered in previous class. Okay, I have till now I have not started a new topic. I am just recap the previous topic. See, the next topic which we covered in my previous class, that was organ specific, tissue specific. Some students are also sending me a presence now, but beta you all are very late. Some students they are very late for class. You have to present on time. Okay students. Hanji beta, next question, next topic which we just covered in our previous class, that was organ specific, tissue specific manifestation. Okay, that topic we have covered in our previous class. See, pathogen can enter our body through different route. It can be through nose, it can be through mouth, it can be through skin, it can be through blood. These routes are called portals of entry through which pathogen enter into our body. Okay, like if pathogen enter, there are some portal related specificity, there are some non portal related specificity. Like if virus it entered through nose, it always affect respiratory tract, accordingly it causes diseases common cold. If any bacteria enter through nose, it will also affect respiratory tract, causes disease, tuberculosis, pneumonia. Accordingly, their symptoms will be there. Okay, like if enter through root, target to particular organ, accordingly there will be symptoms. ऐसा नहीं है कि if enter through no, symptoms will be headache, pain in joints. No, the organ which is affected by a microbe enter through a root, accordingly there will be a symptoms. If it affects respiratory tract, always symptom will be breathlessness, difficulty in breathing, coughing, these kind of symptom. Okay, if it will affect stomach, target is stomach, diarrhea, stomach pain, fever, these kind of symptoms will be there. Symptom will be according to a organ affected by microbe. Is that clear? So this is a organ specific, water related and non-water related specificity. Then we discuss about what are the common effects of infectious diseases on body. Infectious disease की common effect क्या है जो हर disease में होते हैं? Fever, redness, swelling. ठीक है, these are the common effects. In this we have discussed about inflammation. क्या होता है ये inflammation? When any pathogen enter into our body, our immune system get activated in response to that pathogen and start producing antibodies. That antibodies act as soldier and squanger for body, and this process, this defense mechanism of antibodies against that pathogen or infectious agent is called inflammation. And in this process there occur some common effects: fever, redness, swelling of that particular area. Okay, then we discuss about sign and symptom of disease are related to organ which is infected by pathogen. If pathogen infecting brain, symptoms will be headache, vomiting, unconsciousness. If pathogen affecting lungs, symptoms will be cough, pain in chest, breathlessness, damage to lung tissue. Symptoms will be according to an organ affected by a pathogen. Is that clear? Then we discuss about disease manifestation. Manifestation मतलब in which it depends upon number of microbes. In number of microbe is less, disease is less. Manifestation is less. Number of microbe is more, disease is more. Its effects are more in our body. Is that clear? Then beta, okay, if you are just sending me some question, I always give answer in the end of class through my voice message. Okay, I just give you answer. Okay, beta, now I have to just cover one topic, that is, my video is blurred or clear? Yes, beta, video is clear. Send me answer on my question. Okay, beta. Any of the student, it is blur or? Let me check. Some students, let me see the camera. Now I think it is clear. Now it is clear, beta. Okay. Now it is clear. Fine. Okay, I got answer from many of the students. Now it is fine. Yes. Okay. Okay, beta. If any buffering is there, beta, this is only a network issue. I can't do anything else for this. You can see later on my recorded video. Tomorrow it will be uploaded on Facebook also. I just send you link also for my video. But it is only a network issue. I can't do anything else for this. Okay, beta. So let's start today's topic. That is AIDS. AIDS is left. Beta, it is very, very, very important topic of this chapter. This you have to do. After 10 minutes of this topic, I will discuss principle of treatment of disease. AIDS. What is the full form of AIDS? This is the first question. Very, very important. They can ask in exam. What is AIDS? AIDS is acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome. AIDS. Is that clear? Then beta, it is caused by HIV virus. It is caused by HIV virus. Full form of HIV virus is human immunodeficiency virus. These two are important question. Its full form and it's caused by which virus. You have to just know about virus. You have to just know about their full form. 1 mark for 1 mark. It is a very, very important question. Now, question is how AIDS caused. How AIDS is caused. Main question is AIDS. AIDS, it is caused by a virus. Hanji, beta C, mode of transmission of disease. How disease separate from this infectious to healthy person. How it separate from infectious to healthy person. Use of contaminated syringes, razor for shaving, and blood. So it is actually sexually transmitted diseases. AIDS, like if anyone, like if we use razor for shaving, if that person is infected with the AIDS virus, then that razor, if we are using on another person through blood, it will be passed to that person. Is that clear? Infected needle, if doctor, this virus is always present in the blood. If virus use a needle for injection for particular person, that person is suffering from AIDS, same needle that used for a other person, healthy person, that there is 100% chances that virus will be spread from that infectious person to healthy person. If we just donate blood to any person, if in our blood virus is present, definitely that will pass to that person. Blood transfusion, organ transplantation may also there is probability that virus will be passed. Okay. Now beta, what will be the symptoms of this disease? Okay, it will just take time. Swollen glands, fever, susceptibility to infection, weight loss. Actually, I want to just let you know about AIDS. Something, if after a person has been infected by AIDS, year may pass before symptoms develop. Some people carry the virus yet not shown the symptoms. Virus अंदर enter कर चुका होता है, but symptoms नहीं होते. It will just take time to show that symptoms. Okay, so it is not for a. So HIV is transmitted by direct infection of the bloods. ठीक है, बेटा. After this, there is no evidence to suggest that disease can be passed by droplets also. ठीक है. So when AIDS first appeared, there were no effective drugs. There is a range of drug that we can just given little bit relief from that disease, but there is no drug because it is a viral disease. It is very difficult to make antiviral drugs. So till date, there is no particular treatment for this disease. So best way to avoid sexually transmitted infection, to avoid having sexually intercourse with infected person. This is the best way. Always check what doctor are using. Always check the razor. Is it clean? It is new, which the person is using. So beta, you have to just take certain precautions. Okay beta. After this, what is the main thing you should know about AIDS? That is the main important things regarding AIDS is effect of HIV on immune system. Hanji, what is the effect of HIV on immune system? This is the main concept which you should know. What is the effect? Okay, हाँ जी बेटा. See, HIV when enter the body, it directly attack on our immune system. There are different kinds of cells present in our immune system, like T cells, B cells. These cells produce antibodies. लाइक बेटा नॉर्मली क्या होता है, जब कोई पैथोजन एंटर करता है ना बॉडी में, हमारा सिस्टम क्या करता है, इम्यून सिस्टम, इट गेट्स एक्टिवेट. आई एम जस्ट टॉकिंग अबाउट नॉर्मल, नॉट HIV राइट नाउ. इफ एनी पैथोजन enter into our body, our immune system gets activated in response to that pathogen and start producing antibodies for it. ठीक है, there are certain cells in our immune system that produce antibodies and fight against that pathogen and kill their effect. ठीक है, but in case of in this way our immune system act as defense mechanism for us. ठीक है, act as soldier and scavenger for our body. But in case of HIV, virus directly attack on our immune system. उसने सीधे अटैक ह्यूमन सिस्टम पे करना है. नाउ आवर इम्यून सिस्टम कंसिस्ट ऑफ cells, T cells, which are now not able to produce antibodies. Like अब हमारा defense mechanism will not work. Only we are just getting treatment. AIDS patient, we are just getting treatment from outside. Our immune system will not help us. ठीक है, because virus directly attack on HIV, directly attack on immune system. Immune system is not able to produce antibodies. Small infection lead to a big disease. Normally क्या होता है, अगर कफ है, cold है, without treatment from outside, our immune system will treat it. We will just recover very soon. But if virus attack on immune system, our immune system not get activated, it will not produce antibody, not give us any kind of protection, okay, from against diseases. So that virus will multiply in our body, and body small infection leads to a big problem. Small cough leads to a tuberculosis. Small cold lead to a very soon pneumonia. So AIDS is not only a disease, it is a syndrome. Syndrome means multiple set of symptoms occur together for different disease. जो एड्स पेशेंट है ना, वो एक एड्स नहीं है, उसको निमोनिया भी हो जाता है, उसको ट्यूबरक्लोसिस भी हो जाता है. ठीक है, सो सिंड्रोम का मतलब क्या होता है, मल्टीपल सेट ऑफ सिम्टम्स अकर टुगेदर. क्लियर? Multiple set of symptoms occur together for different disease. So AIDS is a fatal disease. It is very difficult to recover AIDS patient because it is very difficult to make antiviral drugs. Virus mutate very fast. Mutate मतलब multiply very fast. One drug is not able to control so many virus in our body. Is that clear? कोरोना वायरस है बेटा, it is also viral disease. ठीक है, so it is also very difficult to make antiviral drug because virus बहुत जल्दी multiply करता है body में. Its mutation rate is very high, multiplication rate is very high. ठीक है, so it is very difficult to control it. Okay, so बेटा we have discussed about AIDS, acquired immunodeficiency syndrome caused by HIV virus, human immunodeficiency virus. This virus directly attack on our immune system. Our immune system is not able to produce antibodies to fight against that pathogen, and small infection lead to a big disease. So AIDS is a syndrome, not a disease. ये एक disease नहीं है. It is a syndrome. Syndrome मतलब multiple set of symptoms occur for disease together. So I just give you 3 questions as a homework you have to do. Still, if you face any doubt, just send me a WhatsApp. Immediately, I just give you a reply for that answer. Please write down 3 questions related to AIDS. Please write down. And all these questions are hot questions. Question first. AIDS is a fatal disease. Why? Second, why is immune system? Let I try for this question. If you will not be able to answer that question, send me answer on the WhatsApp. Not able to do, I just give you answer. Why immune system essential for our health? Next question. Why is AIDS considered to be syndrome, not a disease? Why AIDS is considered to be syndrome, not a disease? Next question. Why does a person suffering from AIDS become sick frequently? You have to do this question, beta. This is your homework. This is your question regarding AIDS. Beta, risk of catching a sexual transmitted diseases can be greatly reduced if the man use a condom or a woman use a famidome. These act as barrier to bacteria or viral diseases. So this is a just to prevent from sexually transmitted diseases. We have to just take some precautions. Okay, beta, this was about AIDS. Bache, one thing. In next lesson, Monday, I will discuss different type of bacterial diseases, their symptoms, their prevention and control. Okay, different type of viral diseases, different type of sexually transmitted diseases that are very very important for your exam. I will discuss their symptoms, mode of transmission, their prevention and control in detail. Till now, I have not given you any kind of explanation. Some student ask me question about symptoms of staphylococci acne also. I just discuss everything in detail about diseases and their symptoms and their control. Don't need to worry. I not covered it with any topic because I don't want to intermix any topic. That is a separate topic. I don't want to get confused you. Okay? So, bache, I hope you all have written this. Now, beta, I have to start next topic. That is very, very important. I have to start the next topic. That is a principle of treatment. Hanji, principle of treatment. I hope you have written, beta. May I start because time is only 20 minutes left and I have to cover that topic. Principle of treatment. I just give you 1 minute more. Okay, now let's continue with the, I don't want to take more time. If you have not written, you can just send me message. I again send you question also on WhatsApp. If anybody missed to write the question, just send me a message on WhatsApp. Just click the photo and send you question also. Okay, beta. Now next topic is very also important. That is principles of treatment. Principles of treatment of infectious diseases. Infectious diseases. Yes, beta. Please, you have to maintain notes also. Whatever I am writing on board, it will help to understand the content given in the NCRT book. Okay, beta, there can be two ways of saving individual and community from infectious diseases. One way is treating the patient, and second way is we have to just take certain precautions like preventing the infection to occur. Infection to occur. So there are two ways by which we can just prevent community and particular organism from infectious diseases. Okay, beta. First of all, we have to give them treatment. Second, disease hoina. We have to just take certain precaution in advance to prevent from infectious diseases. Okay. So here, first of all, we will discuss about treating the patient in this topic. Principle of treatment. Next topic is principle of prevention that we discuss in separate lesson. Okay. So beta, today we will discuss about treatment of diseases. Principle of treatment. Beta, whenever you have any problem, you just go to a whenever. Excuse me, beta. बेटा मेरी क्लास लग रही है. Okay, beta. Whenever you have any problem, you just go to doctor. Okay. First thing, you will just go to doctor. You just tell them certain set of symptoms. You will not tell them like you are just suffering from this disease. Doctor पूछता है क्या problem है. Then you just start telling that I have a fever. I have just pain in my stomach. I have just cold. Whatever the symptoms you have. You should always just tell them a certain set of symptoms which occur together. Then doctor will just tell you to take write certain medicines for treatment to reduce the effect of symptom of disease. So बच्चे for principle sorry so बेटा principle of treatment के लिए first of all what happened, what first thing is reducing the effects of symptoms of disease. ठीक है. डॉक्टर क्या करता है, वो एक मेडिसिन लिख देता है ताकि जो भी सिम्टम्स है उसका इफेक्ट कम हो सके. इफ यू आर हैविंग पेन, वो बोलेगा दिस इज अ पेन किलर, यू हैव टू टेक, इट विल जस्ट रिड्यूस द पेन. ओके. सो फर्स्ट थिंग इज इट रिड्यूसेस द ट्रीटमेंट में व्हाट इज फर्स्ट थिंग, reducing the effects of symptoms of disease. कैसे? According to this, patient is given to how we have to just reduce the effect of by giving medicine. By giving medicine. Clear है? By giving medicine, the patient is given medicine to reduce the symptoms like fever, pain, stomach aching, nausea, body aches, cough, cold, and by suggesting bed rest. So there are two ways. One is by giving medicine, second is by giving bed rest. We can just reduce the effect of symptom of disease. कैसे कर सकते हैं? By giving medicine and by by suggesting bed rest to that person. Okay, this is a first way. Okay. First way is reducing the effects of symptom of disease by giving medicine and by suggesting bed rest. Then next is, this kind of treatment is only temporary relief from the symptom but does not cure the disease. It is only temporary. क्या होता है, मेडिसिन लेते हैं, थोड़ी देर के लिए उसका इफेक्ट होता है, पेन नहीं होती एंड जो भी सिम्टम्स है वो क्लियर नहीं होते, आफ्टर सम टाइम इट अगेन रिपेयर. लाइक फीवर थोड़ी देर के लिए चला जाता है, फिर से हो जाता है. सो दीज आर ओनली टेम्पररी रिलीफ. This give only temporary relief from the symptoms but does not cure the disease. So what is second point which we have to do? Second thing what we have to do is, hope you all have written, everyone you have written this, so that I can just mention the second point in principle of treatment of infectious disease. Second point is killing of pathogen. Killing of pathogen. Pathogen मतलब infectious agent. Pathogen क्या होता है? Infectious agent. Like bacteria, virus, जो भी बॉडी में एंटर किया है उसको हमने किल करना है. उसको किल कैसे करते हैं? Pathogen are treated with medicine. ठीक है? Like, but mainly we have to just give them antibiotic. एंटीबायोटिक क्या करते हैं? ब्लॉक एंटीबायोटिक. वी हैव टू जस्ट गिव देम. कैसे करना है किल पैथोजन? बाय गिविंग एंटी. प्लीज नोट इट डाउन. एंटीबायोटिक. I already discussed in my previous class about antibiotic. Antibiotic block the cell wall formation of bacteria. अगर हमारी बॉडी में बैक्टीरिया एंटर कर जाता है, एंटीबायोटिक interfere with their biochemical pathway. They block the cell wall formation of bacteria. Bacteria is now not able to multiply in our body and kill. In this way, they kill the pathogen. Is that clear? So, reduce the recover the patient from that disease. Okay? इसमें क्या करते हैं? कैसे करते हैं ये पैथोजन? They just pathogen like antibiotics क्या करते हैं? They interfere with their pathway and block the cell wall formation of bacteria. Interfere with their biochemical pathway. Now bacteria is not able to multiply in our body. So antibiotic block their pathway. Is that clear? Interfere their pathway. Is that clear? In this way they kill the pathogen. So this is the principle of treatment of disease. ठीक है बेटा? Main example of antibiotic is penicillin. Penicillin is used for treatment of bacterial disease. Clear है? For different disease, there are different kinds of antibiotics as per their biochemical pathway. Okay, now what this was about principle of treatment. First thing is reducing the effect of symptom of disease by giving medicine, by suggesting bed rest. Second is killing of pathogen by giving antibiotic. This is the only principle of treatment. Now, what is the limitation of? Next topic is limitation of principle of treatment. क्या limitation है इसकी? What is the drawback? Limitation मतलब इसकी क्या drawback है principle of treatment? First is damage to. This can be a separate question beta in exam. Damage to body function. Please note it down beta everyone. Body function. Second point is loss of working days. Third is source of infection. ठीक है? Source of infection. So, in this, first of all, what is the limitation? What is the drawback of principle of treatment? Damage to body function. See beta, body function of patient all damage. They may सी अगर कोई भी डिजीज होती है बॉडी अफेक्ट करती है, हो सकता है कि बॉडी के फंक्शंस भी इंटरफेयर करते हैं इससे, नॉट वर्क प्रॉपरली, सो डैमेज टू बॉडी फंक्शन. ठीक है, ट्रीटमेंट करने से पहले अगर कोई डिजीज होती है तो इट विल जस्ट ऑल्सो अफेक्ट द बॉडी फंक्शन. सेकेंड, लॉस ऑफ वर्किंग डेज बिकॉज द डॉक्टर सजेस्ट बेड रेस्ट, तो वर्किंग डेज लॉस होते हैं. थर्ड, source of infection. If any person is suffering from any kind of disease, there will be chances to spread of disease from infectious to healthy person. So in the end, you have to write prevention is better than cure. So prevention is better than cure. Like cure मतलब treatment से better क्या है? Prevention of disease. Disease हो ही ना. We have to just take certain precautions. Like अभी जैसे कह रहे कि कोरोना वायरस है, you have to just wear mask, you have to just hand wash, ठीक है, again and again. So these are the precautions to prevent us from diseases. So prevention is better than cure. Question कैसे आएगा आपको? They will not ask the question what are the limitation of principle of treatment. They will ask you the question why prevention is better than cure. And this is 100% sure question for exam. Why prevention is better than cure? Then what you answer you have right? You have to write because during treatment there may be chance of damage of any organ of the body which can interfere with their body functions. There will be a loss of working days. There will be a source of infection to others. So prevention is better than cure. ट्रीटमेंट से अच्छा है डिजीज हो ही ना. क्लियर है? And beta, you should know the answer of this question. This is very, very important. I'm again and again, I'm just telling you. For final exam, for any exam, why prevention is better than cure. Is that clear? You have to just write these 3 points. Clear to everyone? Then beta, next question, please note it down. Hanji, next question is also very, very important question. Today, whatever I have discussed, it is a very, very important. After the completion of this chapter, I will just take 2 lessons to only discuss important questions of this chapter. At least 50-60 questions I will discuss from this chapter in that 2 lessons. Is that clear? After the completion of this chapter. Okay, beta. After this, next topic is also very, very important. It is a sort of one question. Very, very important. Please note it down. Question is, beta, please open your NCERT book, everyone. This question which I am just now trying to just cover, it is given on a page number 185. After the principles of treatment, this is given last paragraph. Last paragraph, please. Please see the last paragraph of topic NCERT principle of treatment. Please open it. Hanji. Why making? Question is given on first 2 lines. Why making antiviral medicines is harder than making antibacterial medicine. Even they can ask this question in a different way. why it is very difficult to make antiviral drugs. Why it is very difficult to make antiviral drugs. In the same way they can ask the question, why it is very difficult to make antiviral drugs. Hanji, if you have written the question, may I explain it? I just have a 6 minutes. I just want to explain this answer. In case of bacteria can block they have their own biochemical machinery. Bacteria, they block cell wall formation of bacteria. Bacteria is not able to multiply. So, but in case of virus, they don't have their own biochemical machinery. When they enter into host outside, they are non-living, but when they enter into a living body, host body, they start using their machinery and start reproducing. They mutate very fast, multiply very fast. So it is small time there will be more virus in our body. So it is very difficult with one drug to control so many virus. So it is very difficult to make antiviral medicine. Again, I'm just repeating, virus have very little hereditary material that control a few biochemical mechanism. It contain a very few. देखो सबके अंदर जेनेटिक मटेरियल कौन सा होता है, डीएनए. बट वायरस दे हैव आरएनए genetic material. They have a very little hereditary material that control a biochemical pathway. They mutate very fast, they multiply very fast. One drug is not able to control so many viruses. So it is very difficult to maintain antiviral drugs. This is the answer. Answer is also given in your book. If you face any problem in writing the answer of any of the question, I will just send all these questions in your weekly revision worksheet and along with answer key also. Is that clear? So today what we discussed first of all, we revised the previous topic, that was mode of transmission of disease, organ specific manifestation. Then I discussed about a very important topic, that is AIDS. Let me check some students asked me some question. Ma'am, explain this question again. Why not, beta? I'm just let me check. Okay, beta, I just explained the answer again. See, in case of why it is very difficult to make antiviral drugs, because virus, they have a very little hereditary material. Hereditary material hota hai, like we have a hereditary material DNA which can be passed to our offspring, from parents to offspring. Virus, they are outside, non-living, but when they enter into body of any body, they start reproducing. Virus have a very little hereditary material that control any pathway. लेकिन केस ऑफ बैक्टीरिया क्या होता है, बैक्टीरिया क्या करता है, ब्लॉक द सेल वॉल फॉर्मेशन ऑफ बैक्टीरिया. सॉरी, एंटीबायोटिक ड्रग्स होती हैं, एंटीबायोटिक्स, दे ब्लॉक द सेल वॉल फॉर्मेशन ऑफ बैक्टीरिया, बिकॉज बैक्टीरिया है उसका अपना एक बायोकेमिकल पाथवे है. बट वायरस है, डोंट हैव देयर ओन बायोकेमिकल पाथवे, और दे हैव वेरी लिटिल hereditary material that control that biochemical pathway. ठीक है. So and virus multiply very fast in number. अगर हम एक ड्रग दे भी देंगे तो इतने सारे वायरस को वो कंट्रोल नहीं कर पाएगी. It is very difficult to control. So okay, so it is very difficult to control. Virus beta is the intermediate. It is neither living nor non-living. Outside the body it is non-living, but it enter into our body, it start reproducing by using our biochemical machinery. हमारी ही machinery use करके वो start reproducing. and it reproduce very fast. One drug is not able to control so many viruses, so it is very difficult to make antiviral drugs. Okay, beta. Ma'am, how antibiotics are made? Please, let me wait. Ma'am, the one question from one of the student. Ma'am, the answer to the question you give today should be of how much line? Beta, two, 3 lines. You have to just give answer. 2, 3 lines only. 8th question which I have given to you. Answer is 2, 3, 4 lines. Okay. Then, beta, still, if you are having any doubts, you just send me a message on WhatsApp after this live class. Definitely clear your doubts after my live class. Okay, beta, time is over. I think now I have to leave, and because you are having next class. Thank you very much for attending my class. If you are having any doubt, please send me message on WhatsApp. Next lesson, I will start different kind of diseases and their control, their symptoms. Okay, beta. Bye.